pain. One of the things that our clients come into our office, they say they like the most is that when they come in for their first appointment, is that I sit down and I go through the intake form with them. I know I've been to many doctors' offices where they give me a 3-page form that has 1,000 boxes that I have to read through and check, and then they give that to the doctor, and the doctor doesn't even really look at that in detail oftentimes, you know, or the massage therapist will circle the areas that you're hurting. That doesn't really quantify what's going on. All that does is gives you an indicator of whether they're experiencing pain. But remember what we said about our clients don't always understand what's going on in their body. And just because they say they hurt in their shoulder, right, at this point, doesn't mean that that's where the problem is coming from. So it's really important that we have the opportunity. We're spending an hour with them at a time, that we can sit and connect with them and engage them in conversation, and we can really start to do the detective work to figure out what's really going on in their life versus the story that they've created. How many of you guys have had the situation where your client writes down no injuries, and then as you start working with them in the session, they say, oh yeah, you know, 5 years ago I was in this auto accident, or 10 years ago I fell off of a pole that was, you know, 10 feet in the air. All of those are clues as to how the body has to adjust and compensate to any kind of damage that's been done to it. And oftentimes patients, they forget. When we're in pain, we want to, you know, move on beyond that. And so it's very easy for our patients to get in a place where they don't even remember all of the injuries and the issues that they've gone through or they're experiencing. So when you take that moment to connect with them, and you sit down and you ask them questions specifically, that really gives you a very special opportunity to, one, to develop a relationship, which is going to allow you to be in a place with them that very few other medical professionals will take the time to do, because they got to see so many patients. And two, it's going to help them spark some things that maybe they forgot about that can be exactly where the problem is coming from and not just the painful area. So that first step is we really have to get them to be accountable to what they're doing outside of our therapy sessions and start to do the detective work to figure out where the pain is coming from. Say I have a patient who comes in and reports, I get the MRI report and it says herniated and bulging discs in L3, 4, and 5. You know, I care that that's there, but why are the bulging discs happening? Why is the deterioration in the vertebrae happening? That's the next question that we need to ask, is where is it coming from? Why are they having a hard time? You know, I'm experiencing pain in my neck when I do too much computer time, or if I'm golfing, or if I'm playing with my kids, all of a sudden I get some low back pain. That's fantastic, but where is that coming from? And that's going to bring us to the next step, which is the physiological piece. So we have the clients starting to think about where the things are coming from, maybe where their issues have stemmed from or why they've developed. Now we're going to transition into our specialty, which is being able to manipulate the soft tissue, and or if you're a Reiki practitioner or a craniosacral practitioner, as we transition into the energetic work. And we all have to acknowledge that everything is just energy. If we want to be scientific about it, we can say, you know, blood cells, ligaments, bones, tendons, what are they made of? They're made of electrons and protons that form atoms. So technically, everything is just energy, and it all has a vibration. And we understand when that energy starts to get stagnant, let's say we have tissue that gets torn, there's stagnation in that area of energy. And if we're a PT or a chiropractor, the doctor's going to diagnose a lesion of the biceps femoris, and we're going to understand as therapists that there's more things going on there than just the tear. We're going to have the nerve issues, the story to the brain on what's happening in that area is going to be different than what it was before. So the beautiful thing about where it isn't, is that it doesn't discriminate with what kind of therapy that you specialize in. My specialty is the Rolf method of structural integration. So much so that we have a school. We're one of 20 schools that are recognized by the International Association of Structural Integrators as being approved to teach the Rolf method of structural integration. Massage therapy was great. I have friends that specialize in Reiki. I have friends that specialize in Shiatsu or Lomi Lomi, lymphatic drainage, trigger point therapy, medical massage. There's so many different modalities out there. But what I want you to understand is that whatever your specialty is, when you apply this concept of where it isn't, it's not going to matter what you do. The other beautiful part in the fact that this doesn't discriminate is that it doesn't matter what kind of patient you're working with. If you have a patient who is old, if they're young, if they're super active, if they're extremely inactive, if they're a high-level athlete, we work on a huge amount of Olympic and professional athletes. I'm on the medical team for Division I colleges. It doesn't matter. You can have your stay-at-home mom who loves to take care of her kids, or you can have the cyclist that rides 200 miles a week, 200 miles a week. Your specialty is going to be able to help them no matter what. So how do we understand where it is in regards to the body? So as we understand that everything is connected, we need to look at the structure of the body and where the body should be. So how do we know if a body is more balanced or less balanced? It's pretty simple. We're going to use two very, very simple tools. We're going to use a horizontal or a vertical line, and we're going to use a horizontal line. And what happens is that when we look at the body, there's certain points in the body that should be perfectly horizontal, or there's areas of the body that should be perfectly vertical. And we're going to go through some pictures here in a minute with some patients and show you what happens when those pieces and parts aren't in line. So if we just look at my shoulder girdle, for example, if my left shoulder is higher than my right shoulder, what happens is that I'm going to start experiencing some kind of typically neck pain. But oftentimes, we're going to have pain in other areas of the body due to compensation. Because remember, everything is completely connected and locked and woven together. So as a patient is standing before you and they say, I'm having all sorts of migraines and neck pain, as we look at that, where is the problem coming from? Now, the patients have reported that the pain is in the left cervical spine, but is that where it's stemming from, or is that the condition of a tight neck? Or is that a condition from a tight rib cage pulling the right shoulder down, which then elevates the left shoulder? Those are the things that we need to think about. So the question that I asked you earlier at the very beginning is that where are the most common areas of pain in your clients? How many of your patients state that they have pain on the front of their neck? How many of your patients state that they have pain on the front of their chest? How many of your patients state that they have pain in the abdomen? Most patients, what we found through our research in our clinic with hundreds and hundreds and hundreds of patients, is that the majority of the pain areas that our patients report is on the posterior surface of the body. Everything back here. Almost all of our patients report the back of the neck, the upper back and shoulders. Oh, I carry all of my tension in my shoulders. I carry all of my tension in my back, which is true. There's a very significant amount of tension going on in the back. But that may not necessarily be where the problem is from. That's where they're experiencing the pain. So here's the next step. A person goes to the massage therapist. The massage therapist, on average, puts them face down on the table, and they spend 25, 30, 40 minutes even working solely on the back. So a patient comes to you, and they report that my head and my neck are hurting. They report that their shoulders are hurting, and that their low back is hurting. So all of that tissue is stretched out and it's elongated, and then the average therapist is going to work on that person for the next hour, 30, 40, 50 minutes, face down. I know I've heard this tons of times. Can you please just spend the entire hour on my neck and my back? So then the next week when they come in, they say, I felt better for a day or two, and then by about Wednesday, I was back to square one, and I have excruciating headaches, and I have a knife digging into the back of my shoulder blades. So you do a session, they feel really great for 2 or 3 days again, and then they're right back to it. And that's that cycle that we see with consistent chronic pain. So what is going on within the structure? Here's the thing that if you get this one concept, then it's going to change your practice forever. I've been teaching for 12 years, and the most common statement that we get from our students is that when they really start to apply these techniques of working the short cables versus long cables, all of a sudden their patients they'd been working with for 15, 20 years got better at a level that they had never achieved before that. So if I'm looking at a patient, let's say we're looking at the patient from the side, and the head is forward and the shoulders are rounded, which is most people. They look like driving, maybe sitting at a computer all day long, or if I'm sitting at home and I'm sitting on the couch, we can see all this tissue rounds forward. But where do we spend the majority of the time in the session? On the back. What we need to start thinking about is that the short cables, if I look from left to right, is that the short cables are actually on the front side of the body, pulling all of this forward and down. It's not until I get this to open up in the front, which will allow the shoulders to settle back, which will allow the head to come back into its more ideal position. And all of a sudden, those cables that were all stretched out and they were holding on for dear life, and as they were holding on, they were pinching on all of the nervous tissue, they were decreasing the size of the vasculature, so not enough blood was getting through the tubes, and so healing wasn't happening. They were actually getting worse. And what we didn't know inadvertently as therapists is that the more that I work that long tissue and I make it even longer, I'm actually increasing the client's problems. I'm making it so much worse than what I could ever imagine. So in your sessions, as you can start to look at the short areas of the short cables, where they're rounded and where things are tight, and how many people will comment, oh, my pecs are just so tender. All you have to do is barely touch it, and it's very, very sore. But you could dig like crazy on the back. And that's because, again, that tissue was too elongated on the back, and the front tissue is too short. Let's come to low back pain. This is going to be something that's very similar. Is that if we're dealing with low back pain, and if I turn to the side, and my pelvis is supposed to be more level if we look at my belt line, but all of a sudden my pelvis is sitting in this position, we can see that it's more forward in the front and it's tilted down and it's up in the back. So let's think about hamstrings. You are having issues in the hamstrings where the patients are stretching their hamstrings and they're stretching their hamstrings, but guess what? The hamstrings are already too darn long, and we stretch them, make them even longer. So what the quads do on the front is the quads start to shorten up, and then they get stuck in that position because that's what you're doing with the body. So when we're dealing with hip pain, low back pain, if we can get those quads to elongate in the front through here, all of a sudden that pelvis can come back to level, the low back gets to open up, and the hamstrings can soften. Imagine if you were playing tug-of-war and you're tugging and tugging and tugging and tugging and you're contracting and you're working, and then the other end is tied to something that's fixed and it starts to stretch out. The tear is going to happen in the tissues that are starting to elongate and they're starting to fray. They're not necessarily going to tear where the pull is coming from. So that short tissue in the front, the pecs are shortened, but the levator, the erectors, the rhomboids, those poor scapulas go wide, and then the next thing you know, they're screaming because they're trying to hold on as everything's rounded. So what we're going to do now is I'm going to transition to some before and after pictures. We're going to take you through some pictures and show you some of the areas where the cables are short versus where the cables are long, so you can start to see that this is not me just making this information up. This is clinically oriented. We have, the proof is in the pudding of the imaging, and we're just going to get to see some pretty amazing pictures coming up here. So hold on just one second.